All right. Welcome, everyone, to the Dietitians for Autism monthly meeting. I'm so excited to have Dr. Amy Rolfsen here with me today talking about gut health and autism, because we all know that gut health is so important for children on the spectrum and really is the cornerstone that we should be looking into of all things gut health, nutrient deficiencies. I mean, there's so many reasons why we really need to look into the gut. So I will go ahead and introduce Amy. And Amy, you get to give a better introduction after I finish. But Dr. Amy Rolfsen is a naturopathic doctor and medical consultant. She runs a private practice and focuses on women's and children's gastrointestinal health. She's also a medical educator with Diagnostic Solutions Lab, where she helps practitioners dig deep into the GI map stool test. So I'll go ahead and let you take the floor.
Thank you, Britton, and thank you for having me. So I think everything Britton said is probably all I want to say about myself. I am a naturopathic doctor, private practice. Most of my hours, though, are spent with Diagnostic Solutions Lab. I consult with practitioners about 20 hours a week, going deep into the GI map. And so practitioners will call in with their tests, and I go over them and really nitpick and, picking out things within normal range that I think are a little bit high or a little bit low. So really getting in there and recognizing the patterns is one of my passions. And in practice, I do treat a lot of children. I'd say a big subset of my patient population is pediatric, and a lot of those children do fall on the autism spectrum. But in practice, I don't treat autism. I would say I treat people, not conditions. So I don't ever treat autism. I treat the person who is diagnosed within the autism spectrum. And I would say within functional medicine, I would encourage everybody to do something similar. Not getting into protocols, but really an individualized medicine, because when you go through these tests and when you do end up testing a lot of these children, you'll see a lot of different things show up. There's no one set pattern. You'll see a huge range of things, and I'll go over the most common things we'll see in people with autism on this test. So let me see. Okay. So my goals when I'm treating kids on the spectrum is never to cure a child of autism. I'm sure you guys talk about this all the time, where you're not curing autism, but we do have goals, and those goals are to modify anything that is modifiable. Obviously, we know that autism spectrum disorders are a combination of genetic and environmental. And so when there are environmental things that we can change, that we can manipulate, that we can improve, we do so, as long as it's within the goal family and the child and is achievable. We will do everything we can. So the things I'm looking to achieve in the end is increased nutritional status. We know a lot of children on the spectrum do have really limited diets, whether it's from sensory processing issues or just preferences. Sometimes we're looking at decreased, digestive insufficiency. That's what I'm looking at. So they're eating foods and they're just kind of feeling squicky when they eat them, but they don't know why. So food sensitivities, intolerances, and some allergies. And getting that nutritional status up can be really, really challenging when you're working within those dietary conditions. I've certainly seen children's tastes change as you improve their digestive health, as you improve their GI health. And that's really nice to see from a child who will only eat one vegetable. Yay, they'll eat a vegetable. That's great. To go into eating 8 different vegetables, that's a win in my books. And to get that nutritional status up sometimes requires supplementation. But if you can do it through diet, even better. Another goal is to decrease any concomitant symptoms, which just means anything that is associated with autism spectrum disorders that is not necessarily part of the diagnosis. Things like GI health issues, anxiety, insomnia, things like that. We're looking to get those down. I do see a lot of children who have autism spectrum disorders and allergies and asthma, things like that, often do go hand in hand. We're looking to balance the mood. So doing anything we can, neurotransmitters and the uptake of the neurotransmitters. So we're looking to improve anxiety, impulse control issues, aggression, stereotypical behavior, things like that. And then we're looking to increase independence. And to me, this kind of encompasses a lot of different things. To me, this is vocalization, so the ability to communicate Whether that is the child's goal or not, maybe they think they're communicating fine, and that is fine. I like to accept the family's goals just how they are. Some families are completely happy where they are with their child's verbal abilities. And we're looking for increased independence in things like toileting and just daily activities so that our patients can eventually make these great choices for their lives and act on those choices and live the life they want to live. So I would say I have seen a lot of really, really positive changes in children on the spectrum. I have seen some children who, by the end of treatment, and there is no such thing really as end of treatment, but have gone from being diagnosable to being no longer diagnosable on the spectrum. So you can see those changes. People can recover, people can improve their daily quality of life and still stay within the diagnosis of autism spectrum disorders. It's all fantastic, and it's all wonderful. And so special challenges when you're working with autism spectrum disorders, communication is a huge one. So a lot of the patients we're looking to treat are either nonverbal, minimally verbal, or have other communication challenges. And so finding out what their symptoms are can be tricky. So you may have a child who is restless, has restless sleep and kind of grunts and sits in a position like this, and that could be abdominal pain. So whether that is or it isn't, and it's really hard to find out and ascertain what this person may be experiencing, and getting a thorough health history can be really, really challenging. So we do our best guesses. I think testing here is really, really useful. I run a lot of different tests. I would say a GI test and the organic acid test are my number 1 and 2 for autism spectrum disorders. Obviously genetic testing, nutritional status testing are really, really useful there as well. But I would say the OAT and a GI map are the 2 that I turn to. Physical exam, I don't know, as nutritionists, whether you're doing much physical exam, but doing things like abdominal exam, sometimes that's possible. Some children you're seeing that are on the spectrum don't want to be, and you do have to respect that within the bounds of consent, is if the child in front of you does not want to be touched, you don't do a physical exam. And that's really important. And sometimes you can miss out on key diagnostics. Specimen collection. So going for a blood test can be really challenging. Collecting a stool test can be challenging. A urine. Some of these things you don't know things are going to be challenging for which families. And I would say on the side that sometimes I find using a potty, like a little sit-down potty, can be really helpful for children who don't want those hands there collecting a stool. So that's one thing that I have found helpful, and not for everybody, but for some people, in getting the specimens to do testing. And now moving on to treatment, dietary limitations. So sometimes you can order 1, 2, or 3 tests and see all these wonderful results and think, okay, well, here's the 9 dietary changes that I would make. We'll add in these 5 supplements and make these changes. And then you talk to the family and realize that those changes are not within reason for what that child is able or willing to do in that moment. So that can be really challenging. All you need to do is get some more veggies in the diet and swallow these 3 pills. And that would be lovely, but sometimes it's not possible. So we work with what we can work with, and sometimes you end up moving slower than you otherwise would, and that can be wonderful too. It's nice to be patient. And then the same thing with supplementations. Even with the liquids, powders, chewables, you're going to find, and I'm sure you've seen this, a range of likes and dislikes. And so I'm working virtually, but a few months ago I had an in-person practice, and my fridge was just full of liquids and chewables and things, because you just have to bring out everything and say, oh, how do you like this one? How do you like this one? How do you like that one? And, some kids will drink the magnesium and say, ew, that's too sweet. And then they'll take the chewable and say, oh, it's not sweet enough. And so you really have to figure out what's going to work for each person. And sometimes, sometimes it can be really challenging and you end up hiding things. So I would say, there may be more challenges that I didn't think of, and I'd love to hear about them, but these have been my personal challenges and things to overcome. And I have enjoyed working around these kind of limitations. It's nice to be creative. So why do we look in the gut in autism spectrum disorder? When you look in the research, you'll see a huge range of prevalence of gut symptoms. And when I was looking, I found anywhere between 4% and 96% prevalence of any kind of GI symptoms, averaging out, I think one paper had an average of 46%, but that range from 4% to 96%, that's a huge range. I mean, 96%, that's almost everybody. 4%, that's almost nobody. So that range to me speaks to the difficulties in proper diagnosis and proper assessment of GI conditions. So here's a quote from the Harvard Review of Psychiatry 2014, emerging evidence for a gut-brain connection in autism, wherein GI dysfunction may contribute to the pathogenesis or severity of ASD symptoms. And over again in the research, you'll see that severity of GI symptoms seem to correlate with severity of ASD symptoms. And then you'll see a huge range again in the prevalence of those symptoms. Most common you'll see is constipation, diarrhea, and abdominal pain, although you will see some reflux, some blood in the stool, things like that, but most commonly either constipation or diarrhea, a lot of gas, a lot of bloating. And so the gut-brain axis, I'm going to go through this really, really quickly. We can talk about it at the end if anyone is interested in going a bit deeper. So the gut-brain axis is this complicated interplay between the nervous systems. There's the central, your brain and all that, peripheral. Enteric is your gut's nervous system, and then your autonomic, so your parasympathetic and sympathetic nervous systems. But in addition to that, you've got your immune system. So all your interleukins, your inflammation, everything like that, which can alter behavior. You've got your endocrine system, your hormones, and then you've got your GI function and your microbiota. So a huge interplay here. And I think that's not the end of my slide. And environment, of course, the environment as well. And so within GI function and microbiota, you're going to find things like gut permeability. How permeable is the GI tract? Is there inflammation? What's the status of the microbiota? Do we have good, enough normal flora? Do we have dysbiosis, which is an imbalance between the good and bad organisms? And then digestive capacity. How are secretions? How's motility? Absorption of nutrients. So there's a lot going on here. And then to get even more complicated, the bacteria can affect your neurotransmitters. And so here are some of the ways that they can interact with neurotransmitters. And I have abbreviated neurotransmitters to NT. So if you're confused about what NT means, it means neurotransmitters. So neurotransmitters control normal GI motility and secretion. So how much gastric acid comes out, how much bile comes out, pancreatic fluids are controlled in part by neurotransmitters. Some bacteria can produce neurotransmitters. They can also consume neurotransmitters. They can alter metabolism of neurotransmitters, and some can impair the conversion of neurotransmitters. And notably, a lot of catecholamines, so the dopamine, norepinephrine, epinephrine pathway, can be really altered by a lot of the pathogenic and opportunistic bacteria. And then some neurotransmitters can act as growth factors, really strong growth factors for pathogenic bacteria, like I want to say it was Yersinia, Enterocolitica, the E. coli's, Salmonella, and I think Campylobacter, although now I don't have my notes in front of me, so I've lost that one. It might be Campylobacter. And neurotransmitters can also induce virulence, induce virulence, which means that a bacterium that has the potential to produce a toxin may not be doing so, but in the context of stress. So if there's a lot of norepinephrine around in the system, that bacterium, so an E. coli that was present, may suddenly grow exponentially and start producing its toxins. Whereas in an environment without stress hormones, and it's not all neurotransmitters that can induce these, it's really the dopamine, norepinephrine, epinephrine, the stress hormones that can do these last two things. So in the context of high stress, it can actually lead to bacterial growth and virulence. And then another aspect that I'm not going to go deep into is neuroinflammation, which I'm sure you've heard about many, many times in your discussions. I'm just going to say one thing about it. Inflammation in the GI tract can lead to inflammation in the nervous system, especially if there is hyperpermeability, so a leaky gut, plus inflammation can lead to that neural inflammation. And a lot of those inflammatory cytokines can alter behavior. They can induce things like aggression and impulse control issues. Kind of pushing people away. That interleukin-6 can cause people to not necessarily be aggressive, but to kind of seek out alone time. But it is a huge deal, and in autism spectrum disorders, neuroinflammation can be very real. So I think I've driven that point home about the gut-brain axis. Here's the test that I work on. The GI map is the main test that we run at Diagnostic Solutions Lab. We do run other tests that are fantastic, but this is the one that I spend most of my hours on. It is a stool test, and it is a PCR-based test, which means a DNA test for organisms. And the quantitative PCR is especially valuable here. So it doesn't just give you a positive or a negative for an organism, but it tells you exactly how much. We're really, really sensitive at high highs and low levels. So you can see if you have, 7 lingering low level infections, or if you have 1 smoldering huge infection, you will be able to differentiate between the two. What I love about DNA-based testing is that you can pick up organisms that would not otherwise be culturable. So if you're running a culture lab, a lot of these organisms in the gut are anaerobes, which means they can't live in oxygen. So they don't survive in a petri dish. So you would never know. So things like Clostridia that can be really, really impactful in autism spectrum disorders are anaerobes. And sometimes they culture and sometimes they don't. But in a DNA-based test, you will find it. So we're looking at bacteria, a lot of bacteria. We're also looking at parasites, fungi, and viruses. And then at the end of the test, we're also looking at intestinal health. So that really rounds it out, making it a comprehensive test. We look at digestive function, immune function, looking for blood and inflammation, gluten sensitivity, and then you can add on zonulin for intestinal permeability. And then I think that's all I want to say about the tech, although I'm open to so many questions at the end. But when I was in practice and not working for Diagnostic Solutions, this test was a game changer for my patients. And it really changed the way I do gut testing and treat GI health. So I would encourage you, if you haven't used it in your practice, try it on yourself. It's a great test. But I'm going to move on and talk about some of the most common patterns or findings in autism spectrum disorders on the GI map. So we see a lot of overgrowth. We see pathogenic overgrowth. We see normal or beneficial flora overgrowing. We see opportunistic organism overgrowth. So the opportunists are neither good nor bad. Well, they can be bad in large amounts, but they're not quite pathogens because they won't take over a healthy system. But if they're given the opportunity, they can take over. And I have a case later, if we have time to go over, where you'll see that the opportunists are really taking over in a big way. And they can cause a lot of inflammation, a lot of issues. They can lead to food sensitivities and things like that, and a lot of GI pain. Low beneficial flora is a common finding on the test. And I would say, before I get too deep in this list, you'll never see the same thing on every test. So some patients, you'll look and you'll see low flora and permeability, but no overgrowth. Sometimes you'll see overgrowth of pathogens, normal flora, opportunists, yeast, parasites, and no obvious permeability, although I would always heal up the gut. And sometimes you'll see only inflammation. So it's hard to know what you're going to see based on symptoms. And I keep trying to guess, and I keep being completely wrong when the test comes back. And that's kind of fun and humbling, right? So we see a lot of poor digestion and metabolic issues. On the test, we don't always see the metabolic issues, but we can see a bit of liver dysfunction. We can see pancreatic enzymes. And we can see fat absorption. So that's really, really interesting to see. And then we can see organisms that reflect metabolic issues. So a lot of organisms that, say, grow in a medium of undigested proteins, or carbohydrate-loving organisms overgrowing, you'll see patterns like that. And when you see those on your test, call in and we'll help you kind of decipher what those patterns mean, because we have a team of 7 or 8 of us, and we are really good at teasing out those patterns for you. So we see a lot of food sensitivity and allergy, and I'll show you what that looks like on the test. We see inflammation sometimes, and sometimes no inflammation. And then we see a lot of intestinal hyperpermeability. So I would say that is the most common thing that we'll see on most tests is that piece of permeability. And that, sorry, I was going to stay on that for just another moment, and now I can't remember what I was going to say here, but looking at the test, you can get a lot of information and you can act on that. And, you know, within the bounds of your particular patient's abilities to make changes, you can see a lot of changes based on the results. I do find the results of this test really, really clinically relevant. And I know, Brittany, you've run a lot of these tests, so you've probably seen some big changes. Okay, so I'm going to move on and I'm going to go through each of these patterns one by one. And so I've taken little snapshots of the test just to show you what that section of the test looks like when it is lit up. So here's page 1 as our pathogen page. This is not the whole pathogen page, but the whole thing didn't fit beautifully on a slide. So this is the bacterial section. This is what it looks like when you have pathogens present. The normal finding on page 1 is nothing. You don't want to see anything. You want to see below detection limit. There's my cursor. Can you all see my cursor there? Okay, perfect. Yeah, so this here, less than DL, below detection limit, is the normal finding. We do have a normal range, but it's my personal opinion that there is no such thing as a normal finding on page 1. There is nothing that could be normal on the pathogen page. If you saw one organism at this level, at the E0 level, which means the single digits, and we're working in scientific notation, if you see one finding, okay, I'll let it slide. That may just be something passing through. But when you see 6 findings on page 1, that is an issue. So this is showing that this is a system that is a good host of pathogens. Maybe there are stress hormones acting as growth factors here. But what we see here, C. difficile is a really common finding, well, fairly common finding, I would say, in autism spectrum disorders. Clostridia can be implicated in dopamine dysregulation and increase in dopamine. So C. difficile can induce the release of dopamine and norepinephrine, can increase those levels, and it can also impair the conversion of dopamine to norepinephrine. So you can end up with a buildup of those hormones, which can really alter behavior. And we also see Clostridia class under the normal flora. So sometimes you don't see this Clostridioides difficile, so the pathogenic form overgrowing, but you do see the Clostridia overgrowing in the normal flora. And I think the next slide may show that, if I've got my slide orders correct. And here we see the toxin A and toxin B. These are not the actual toxins, but the genes that produce the toxins. So we don't necessarily know at this level, and we're looking at the E3 level, which means times 10 to the power of 3, or in the thousands here. In the thousands, you may not be producing these toxin A and toxin B, but you've got the potential to do so. And then here we also see 3 E. coli's here. E. coli's can also produce some catecholamines, some stress hormones. Some of the Escherichia genus can also produce serotonin, and in some people with autism, some people with autism, increased serotonin can be an issue, and increased uptake of serotonin can be an issue. And so 3 different E. coli's here, and a bit of Yersinia enterocolitica. So this would be problematic. This would likely be causing some form of GI symptoms, although it may not be diarrhea, which would be classic for a huge infection with these organisms. Sometimes you'll see constipation with a picture like this. Sometimes you'll just see gas and bloating. I think rarely you would see blood in the stool with a picture like this. So I'm going to move on. And yes, overgrowth of normal flora, Clostridia. So the Clostridia class here, it does fall within normal beneficial flora. Most of these Clostridia are beneficial. They'll make your butyrate, and they can be anti-inflammatory. But when it overgrows in the E9 level here, I do see a lot of anxiety, not necessarily across the board, but it is common to see anxiety. I see a lot of impulse control, kind of outburst aggression, and impulsive behavior when I see Clostridia high. And this does correlate really well with the organic acid test Clostridia markers. Sometimes you'll see this, sometimes you'll see the C. diff on page 1. And sometimes you will see other normal flora overgrowing. Within autism spectrum disorders, it seems like in the research, there is often low bifidobacteria and sometimes low Bacteroides, although in this case, we're not seeing it here. These look like nice, robust levels. Sometimes there's high lactobacillus, sometimes there's low. Very often there's low Akkermansia, which is a mucus-loving organism. And when Akkermansia mucinophila is lower, here at below detection limit, sometimes I'm thinking about the gut lining health, the health of the mucosal production. So I'm going to move on in the interest of time because I promised Britton I wouldn't take up the whole hour talking. I'm leaving time for questions. So moving on to deficient beneficial flora, I would say less often than overgrowth, you will see deficient flora. I think I see more overgrowth than I see deficiency in autism spectrum, but we do sometimes see a test that looks quite deficient. So here we see a deficiency in Escherichia, which can actually be a risk factor in pathogenic E. coli infection. Here we actually see low Clostridia, low Enterobacter, and then both the phyla are low. So when we're looking at the phylum level here, we're looking at the population level. So we've got these markers here, and within the kingdom of bacteria, we've got 6 phyla, or big groups of bacteria, and these 2 are the largest, the Bacteroidetes and Firmicutes. Together, they make up about 90% of your bacterial population. And so when these are low, it can be really problematic. And what it's telling us is that the GI tract of the person whose test we're looking at is not hosting bacteria well. And we need to figure out why. Is there not enough fiber producing short chain fatty acids? Is there inflammation? Is the mucosal production not robust enough, not healthy enough? Are we not differentiating into goblet cells at the epithelial cells into the mucus producing cells? Maybe sometimes there's GI damage that can actually affect the populations of anaerobic bacteria. So really trying to tease out those patterns, but when in doubt, when I see a picture like this, I do gut healing. I do work on the lining of the GI tract. I will try to introduce fermented foods. I will try to introduce lots of berries and brightly colored polyphenol-rich foods, a huge diversity of fiber, which in this population is sometimes really challenging and sometimes goes over really well. So sometimes a fibro supplement is well tolerated. But when you see deficient flora like this, often you will see inflammation going along with it. Sometimes you'll see anxiety, low mood, low energy, low immunity. And that, I think, is all I want to say on the normal flora at the moment. Here's a picture of what it looks like when the opportunistic bacteria are overgrown. So here we're looking at things like the Enterococcus, staph and strep, Morganella, Pseudomonas, and then some autoimmune triggers, which I've cropped right off for fun. But Citrobacter, Klebsiella, I don't think there was anything interesting below that line or I would have shown it, but we do have a lot more down there. But these bacteria can be really problematic. What we've got here in Citrobacter and Klebsiella, we've got histamine producers, and that can really affect mood and anxiety. It can really cause some inflammation. We've also got biofilm producers. So Pseudomonas, Citrobacter, and Klebsiella are pretty strong biofilm producers. And when there's overgrowth generally, regardless of which organisms are overgrowing, it can overwhelm the mucosal layer. You can end up with inflammation, with poor absorption, and basically all these organisms consuming the nutrients before they get to the body of your patient. So Pseudomonas here can be especially problematic. I've lost my cursor somewhere. There it is. Pseudomonas can increase sensitivities to food, especially gluten, and it can thrive in an environment with food sensitivities. So it can grow on a medium of casein and albumin, so undigested dairy and egg white proteins, and on gluten. So, I've done something. There we go. Oh, no, I'm going the wrong way. So tech savvy. Okay. So we do see a lot of opportunistic overgrowth on this test for people on the autism spectrum. And you'll see this over and over, more than pathogenic growth, I would say. You'll see a lot on this page, and this is page 3 of our test. And I'm sure I could talk for hours on just this one little snapshot, but I'm going to spare you. Just below the bacterial section, still on page 3, you'll find the Candida section, or the yeast section, where Candida is featured. And sometimes you will see Candida for children on the spectrum. When I was looking in the research, I had always been told that children with autism had more Candida than the general population, but it seems like in the research that is not the case. It seems like fairly equal, but I do see a fair amount of Candida, and I do see it affecting people, and I see behavior and symptoms changing when it gets treated. Now, Candida is a big biofilm producer. It can be quite inflammatory. It can induce histamine release. And so when I see a population like this, I treat it quite heavily within, again, the bounds of what I'm able to give children and what they're able to take. So you will see a fair amount of Candida, but not as much Candida as you will see bacteria. Moving on to assessing metabolic issues and digestion. This is on page 4 of the test, just part of our intestinal health section. So what we'll often see is low elastase. This elastase 1 marker here is measuring pancreatic enzyme output. This won't reflect oral enzyme intake, which is really nice. So your patients can take enzymes and can take this test and know what their endogenous production looks like. Now, optimal is over 500. So this is a suboptimal low level here. I do like to give people support anytime they're below 500. And children, you should see more robust levels than in adults, slightly more robust, but I would say 500 is optimal for everybody. Above elastase is steatocrit here, and that's a measure of fecal fat, so fat absorption. And now 8 isn't a huge problem. Our range is 15, but this is actually measuring the percentage of fat that the stool is made up of. So 8% of this child's stool was made up of fat, and that's a lot of fat to be losing. If your goal is to, if you're wanting to take omegas and have a higher fat diet to balance neurotransmitters and moods and blood sugars, things like that, you want to be digesting and absorbing it all. So this is showing us that somewhere along the line, there is a very minor deficit in fat absorption. So maybe it's at the level of the gallbladder, maybe it's stress, maybe it's malabsorption. We don't necessarily know, but we do know there's a bit of fat in the stool. Beta-glucuronidase, the next finding down. Sorry, I keep losing my cursor. It keeps just evaporating, and I don't know what that means, but I'll keep finding it. Beta-glucuronidase is an enzyme that's put out by bacterial overgrowth. So it's put out by bacteria. And when it's high like this, it can be a surrogate marker for bacterial growth. And this enzyme can reactivate toxins after they've been through phase 2 detox. So anything that's been glucuronidated as part of phase 2 detox can become reactivated in the gut and can get passed back through the bloodstream and into the liver. So when you see a higher beta-glucuronidase in somebody with bacterial overgrowth, I would expect that beta-glucuronidase to come back down as you control the bacterial growth. But I would also expect that that person may have had some stress on their liver for some amount of time. So they've been recycling toxins. And what our test actually measures is not the levels of the enzyme, but the level of activity of the enzyme. So how much it has been working. So depending how long you guess that this has been active, because this really is a one-day snapshot, but in a lot of people, this is chronically elevated and their liver may have been burdened for some time. I have seen a lot of people on the spectrum who do have altered liver detoxification. And so people where I see higher beta-glucuronidase, I'm more likely to give some extra liver support while I'm treating the organisms, especially organisms that can produce histamines and other kind of endotoxins, things that can cause die-off reactions. I'll be a lot more likely to support somebody that has high beta-glucuronidase. So this can be a measure of liver burden. One thing I've listed above that is not really directly reflected on the test is sulfur digestion. So a lot of people on the spectrum do have errors in sulfur metabolism. And a lot of the pathogenic bacteria actually thrive on sulfur. They're sulfur-reducing organisms. On our test, we've got a number of them. We've got our Pseudomonas and Morganella, Citrobacter, Klebsiella, Proteus, and a lot of the pathogens will be sulfur metabolizers. And so if you're not breaking down your sulfur properly, that can predispose to bacterial growth and that more inflammatory bacterial growth, those H2S producers. So that's all I'm going to say on that slide, although, again, I could go on and on. Food sensitivities are really prevalent in this population. Our test looks for an anti-gliadin IgA, which is a marker for a local immune response to gluten. I would say anything over 100 is suboptimal high. It's a bit of an exaggerated response. And you'll often see these high levels. You'll see them, running up to 800, which is a really exaggerated immune response to gluten. Secretory IgA with food sensitivity, sometimes you'll see it really, really low. This is a marker of your gut-associated immune system, your IgA production at the gut lining. This is showing low immunity here, but sometimes, and I would say with equal prevalence, you'll see it really, really high and out of range, showing that your immune system is reacting to something foreign, and often that is infectious, just as often it is foods. And with food sensitivities, often you'll see this high calprotectin, so inflammation. And that's all I want to say on this page. Inflammation here, this looks pretty similar to the last page. This is what it looks like when the secretory IgA is high and out of range. This anti-gliadin, technically that would be normal. If somebody were strictly gluten-free, I still think this would be a little bit high. I would like to see it under 70. But here we've got a high inflammation. So this is showing that neutrophils are infiltrating, and calprotectin is a protein produced by neutrophils. So there is inflammation in white blood cells in the GI tract here. I've gone backwards. So competent with my slides. Okay. Hyperpermeability. I've cut this from two different parts of the test. So here on the top, we're looking at normal flora. At the bottom where it's more red, we're looking at the calprotectin and then this optional add-on of zonulin. So zonulin is our protein that's produced by the epithelial cells to turn on the tight junctions, basically the protein that holds cells together. And when zonulin runs high, it is proof positive of intestinal hyperpermeability. Sometimes it will be low and not necessarily rule out a leaky gut, but it definitely rules it in when it's high. Often in these cases, you'll see inflammation like we see in this case. And these were snipped from the same test. So looking here in the normal flora, this is very typical of what we will see with permeability. So we see both the phyla or the population level bacteria here low. This level at the E9 level for Bacteroidetes, where the bottom of the range goes to E11. So this is about 100 times lower than it should be. That is profoundly low. And Bacteroidetes phylum are quite anaerobic. I wouldn't say they're all obligate anaerobes, but a lot of them are. They really don't like oxygen or GI damage, and they're really sensitive to mucosal health. Lactobacillus and Enterobacter as well are very sensitive to mucosal health. Faecalibacterium is as well, and also sensitive to inflammation. So this would be a picture where I would really focus on anti-inflammatories and gut healing here. And often when there are organisms overgrowing, I'll handle the overgrowth first and then I'll heal the gut. Sometimes I'll have something like glutamine as tolerated in from the beginning of my protocols, but often I will wait until after and then really heal and seal the gut. And that can take a really long time. And I would say even in cases with bacterial overgrowth and infectious levels, often those are really, really persistent in autism spectrum. You'll see infections that you treat over and over and over, and it can be really challenging to go off of treatments. I've seen that over and over where infections just don't seem to clear like they do for different populations. So you may see really, really persistent infections, and you may get frustrated with them. But in those cases, call in and we can brainstorm some things, because there's always something else that can be done. So that's all I have to say on the test. There's a lot of problem solving involved, but I would say first step would be to call in and chat with us about the test will help.
I would absolutely agree with that. I think becoming part of GI Map and learning from you all, those calls in the very beginning when I was a new provider, learning about the gut and learning how to interpret a GI Map were so necessary. And now I can look at it and I feel really confident reading it. I still call you guys sometimes just to help me interpret some of those difficult ones. But I would say if you're a new provider to GI Map and gut health, definitely call them in. My pro tip would be, whenever the patient's sample gets sent off, call the lab and schedule a time right then and there, so that, because the waiting time is usually about 2 weeks. So that's just my thought, but I actually think that that's probably a really good place to finish off today. Thank you so much, Amy, for being here. I know that so many people here really enjoyed what you have to say. I have a billion questions that I could ask you. I took like double-sided notes. So I think we all could learn so much from you, and I really appreciate you coming and speaking to us. Thank you so much. Truly, thank you everyone for tuning in. I think this was our best session yet. I think we all learned so much. I definitely did. So
thank you, Brittany, for having me.
Thanks so much.